If your hips feel stiff and achy, you've likely been told that you have arthritis. Are you doomed to suffer until you're old enough to get a hip replacement surgery? Absolutely not. Of course, the earlier you start taking care of your hip, the better the chances of avoiding hip surgery. Hi everybody, in this video we'll go through the 4 stages of hip arthritis and what you need to focus on in each stage to successfully manage your hip pain, prevent your hip arthritis from getting worse, and potentially avoid hip replacement surgery. Welcome to the Health How To channel, where we talk about some great life hacks and easy tips to achieve better health. Please subscribe and share your best tips that you have found to be helpful for treating hip arthritis so that we can all benefit in our own personal journey to better health. The first thing you need to know is how advanced your hip arthritis is. Keep in mind that there are more than 100 types of arthritis. So for the purposes of this video, we are referring to the most common form of arthritis known as osteoarthritis. Osteoarthritis is joint specific, meaning that it doesn't jump from joint to joint like an inflammatory type of arthritis would. Osteoarthritis is damage to the cartilage from wear and tear. But wear and tear can be from joint misalignment, injury, obesity, and repetitive strain from sports specialization as a kid or from repetitive positions and tasks at work. Although osteoarthritis becomes more common the older you get, it is not inevitable. There is no cure for arthritis, and it can progressively get worse. The earlier you start being proactive with your arthritis treatment, the better chance you have at keeping your joint healthy and let you enjoy the activities that you love. The 4 stages of hip arthritis are: Stage 1. The first stage is when there is a small wearing away of the cartilage and little to no pain that goes away with rest. X-rays often are negative and the joint spacing is still good. One important note about X-rays is that they do not correlate with pain, meaning that you can have an X-ray that shows advanced arthritis, yet the person does not feel pain or symptoms. On the other hand, you can have a good X-ray showing very mild changes. However, the person complains of severe pain. In stage 1, your goal should be to prevent joint adhesions and incorporate challenging hip stretches to target the main hip muscles and movements, like a hamstring stretch for the back of the leg, the butterfly stretch for the groin, a figure 4 stretch for your buttocks, and a hip flexor and quad stretch for the front of the leg. You should be building muscle to keep your hips stable with more challenging hip strengthening exercises like deep squats, kicking, gliding to the side, and reverse lunges. You can also continue doing sports and activities that you enjoy, like golf, soccer, running, and skiing. However, you want to avoid falls, so maybe think twice about contact sports like football and hockey. Don't forget to incorporate a good 5 to 10 minute warm-up before you play, and make sure you wear supportive running shoes. Stage 2. In stage 2 of hip arthritis, you may start to have pain and stiffness after sitting or driving for an hour or getting up in the morning. The pain will go away with rest and tends to also come on when you've been walking or standing for a long time. X-rays can show a little bony spurring in the joint. Stage 2 is considered mild hip osteoarthritis. Treatment for mild hip osteoarthritis should be centered around preventative action. One of the surefire ways to get hip pain is by sitting for too long or with bad posture, so make it a point to get up and move around. Continue doing hip flexor, quads, and rotation stretches, especially if you've been driving for over an hour. If you are an office worker or use your laptop a lot, invest in a good chair and examine your desk setup. But remember that taking frequent breaks with positional changes is actually more important than keeping good posture. Keep up with your hip stretches, aiming to go further into your end range with each repetition. From time to time, you may find that you get a pinching sensation with certain movements, like getting out of a low sofa. If that's the case, adjust your pelvic position by doing a pelvic tilt or tucking your tailbone under. Try some frog bridge exercises to see if that unlocks it. But don't force the movement when you feel a catching or locking sensation because the cartilage may be getting pinched. Focus more on doing floor-based strengthening over weight-bearing exercises when your hip is feeling sore. Exercises like bridges, leg lifts, and ball exercises can help you build muscle strength without aggravating your hip. Now is not the time to limit yourself from all activities. You want to encourage that joint lubrication that happens with end range hip joint loading. As much as possible, try to make sure you can still do a deep bend or at least be able to squat enough to touch the floor once a day. Did you know that the ability to get off the floor without holding onto anything is one of the predictors of how long you'll live? It's basically an indicator of your functional strength and frailty. That's why it's important that you keep your ability to get down on the floor and get yourself up at least once a day. And finally, if the sports you enjoy are causing pain, consider having a sports physio or athletic therapist examine the way you play. Perhaps your golf swing could be altered. Maybe you can decrease your stride length when you run, or change your bike seat height and pedal placement. You may be unknowingly making your hip worse by using poor or inefficient body mechanics. At the very least, think about changing up your sports with the seasons or decreasing the overall frequency so that your hip and body don't get stuck doing the same movement patterns over and over again. Stage 3. Stage 3 hip osteoarthritis is when the cartilage has worn down further. X-rays can show narrowing in the joint space. You might now start to feel pain in the groin, as well as deep into the joint and perhaps spreading down the leg. Your hip might be painful and blocked when you go to end range. You might also feel like your leg will give out, like it won't support your weight, and you may be more afraid of falling. Weight-bearing activities like walking, stairs, standing, and squatting are more painful, and the pain may linger for longer. Your hip may feel stiff in the morning, and you have trouble getting in and out of the car. You may have trouble sleeping on your bad hip and getting up from a soft couch. You're likely limping when you walk. This stage is considered moderate hip osteoarthritis. Treatment for moderate hip osteoarthritis is centered around pacing and modifying your activities. Gentle pool exercises or swimming are easier on your hip. Water therapy is excellent for maintaining your flexibility and cardiovascular system while lessening the weight-bearing load through your joints. Another great exercise is a stationary bike. Hop on the bike for 5 minutes, 3 times a day to keep your hip from getting stiff. Start with small circles, sitting further away from the pedals. As you get more flexible, bring your seat closer so that your knees come up higher and you can get more hip range of motion. Think about changing your angle as you pedal by starting with your knees close together and gradually opening the hips up by spreading the knees as far apart as possible. Try pedaling backwards to work the muscles differently. You might be finding that you're getting more cramping in the quads, hamstrings, and calf. Don't let that stop you. Rather, try to increase the number of repetitions and how long you hold your stretches for. Check out our video on how to stop leg cramps if this is becoming an issue. Keep your glutes strong with floor exercises like bridges, straight leg raises, and side leg raises. These can also be done on your couch or bed if you can't get up and down on the floor. You may need to modify the way you do your activities more and more. For example, consider using a cane, holding it on the opposite side of your bad hip. A cane helps create a tripod base of support, which can reduce the weight going through your bad hip. A car handle that you insert beside your seat may be helpful for getting in and out of the car. Work on your balance. When your hip is stiff or feeling weak and unstable, your reaction time may be a little slower. Practice standing on one leg in front of the counter. Practice turning and looking behind you. Walk sideways and backwards. Watch our video on fall prevention and safety for some ideas. Hopefully you've been working on getting down on the floor and back up again at least once a day. If not, and you find that you just don't have the strength anymore, practice getting up by using your legs to push yourself sideways up onto a stable chair. Continue to try your best to maintain a healthy weight. Check out some of our weight loss and anti-inflammatory diet videos for some more tips. Continue pacing your activities. You may have more success with pain management if you limit prolonged positions like standing to cook or sitting to watch TV. Try to switch your position every 20 to 30 minutes, ideally before your hip starts to hurt or stiffen up. You may find that you can get more accomplished with less suffering the next day if you spread out things like home maintenance and computer work. A sit-to-stand desk can be a game changer. Stretch before you go to sleep. Stretching out your body can help to release the day's accumulated inflammation and give you a better night's sleep, as well as help decrease stiffness the next day. In fact, the reason why you feel stiff in the morning is because the inflammation builds up when you're not moving. That's why it's so important to move your hips throughout their full available range and keep adhesions in the joint from getting worse. Stage 4. The final stage of hip osteoarthritis is when your hip is constantly painful, achy, and irritated regardless of rest or sleep. You're probably exhausted from low energy and inadequate sleep. Your leg might feel like it's heavy or wooden, like it doesn't belong to you. Pretty much all of your activities are limited, including basic movements like rolling over in bed, getting up from sitting, getting on and off the toilet, and getting dressed. Your hips are extremely stiff, and you're probably not able to straighten your hip fully or bend your hip past 90 degrees. Most hip rotation is gone at this point, and you may find that your knee is taking most of the strain. Stage 4 is considered severe hip osteoarthritis. There is hardly any protective cushioning left, significant calcium deposits, and your hip joint is inflamed all of the time. Treatment for stage 4 severe hip arthritis is geared towards controlling inflammation with medication, heat and ice, limiting your weight-bearing activities, and frequent changes of position. Watch our videos on chronic pain and stress relief for help with more serious long-term pain management. Using a long body pillow in between your knees or under your knees can help position your hip properly to get a few more hours of sleep. A rollator walker is a good option for safety and to be able to move around. They are fairly light and fold easily to fit in the car trunk. Also, they come with a basket and seat when you need to rest. At this point, your surgeon will likely recommend a hip replacement surgery to improve your pain and quality of life. Please subscribe and turn on notifications so you don't miss any health how-to videos where we talk about easy ways to improve your health. Thanks for watching, and I'll see you in the next video.